Thanks very much for coming along, everyone. So today we have Dr. Richard Gipps, who is a clinical psychologist, philosopher, and senior research fellow at Oxford University. And he's going to be presenting today on the last chapter of his book on madness. And the talk is entitled Who Gets to Call Whom Mad? So without any further ado, I'll hand over to yourself, Richard. Thanks very much.
Thank you. Who gets to call whom mad? That's my topic today, right? So, whose thought world will be the one judged aberrant? On what basis? Who is it that's attached and who's detached from reality? Or whose reality is the sane one? The poet and I don't know, that's kind of like wild living syphilitic poet Nathaniel Lee, 17th century, as he was being carted off to Bedlam, he said, "They called me mad and I called them mad, and damn them, they outvoted me." Right, that's the kind of thought, right, someone can have. And one finds sometimes a similar thought in certain kind of parts of the mad studies literature, or many a patient might feel that, you know, like if they're psychotic at the time and they're being diagnosed. What gives you the right to say that I'm mad? You seem pretty mad to me, doc, right? Okay. Now, in any particular case, we might say Jones is mad because he truly believes the aliens are after him and that he's a secret agent, right? And that's good. That's right. If you wanted to say to me, you know, you diagnosed Jones as suffering a psychosis, and why'd you say that? You know, and delusion, I guess, is a sine qua non of psychosis. And so I'd say, well, yeah, the reason is he believes the aliens are after him, right? He's a secret agent. That's fine. But imagine instead we ask, what is it about believing that the aliens are after you that makes you count as mad, right? It's not simply the falsity of a belief that marks it as delusion. I mean, lots of us have, you know, we all have thousands of false beliefs. We're not psychotic on that basis, right? And nor do I think we can get to delusion by adding recalcitrance and atypicality to the falsity, right? Because there's plenty of non-delusional eccentrics and enthusiasts around too. Now, I think that the right answer, I'm going to give it pithily, I may come back to this later, but involves something like, well, one kind of right answer. It's not going to scratch the itch of the person asking this question, but one kind of right answer would be to say delusion involves loss of reality testing. And I mean something specific by that term. I don't mean failing to kind of test your beliefs against reality, like a scientist might test his or her hypotheses against reality to see if they're actually true. I think that when people use that term, they're at least gesturing towards something that I'd like to give a more elaborate reflective articulation of. There's a kind of inward collapse of reality-oriented judgment on the one hand, and self-conscious imagination. The kind of when I imagine to myself that I'm, I don't know, sitting on a bench eating an apple, right? I can picture it in my mind's eye. And normally these two things are kept separate, but there can be in psychosis, there is in psychosis an inward collapse of these two states of mind into one another, and so that you've got a denatured version of both, a kind of an unholy hybrid of both. There's a short circuit of the mind that stops these two functions being separate, and I think that is what makes ultimately for delusionality, if you like, in a psychosis. But if you're the sort of person who's minded to ask, but who gets to say questions, you know, who gets to say that, you're just going to repeat it from the answer I just gave. You're going to say, with respect to my lost reality testing answer, well, whose judgment about that stands? Right. And so what do we do with this kind of question? So one answer would be to say we appeal to common consent. I've called this in my book that was mentioned now, I called it an idealist answer. And what I mean by idealism is not that it's ideal, you know, it's fantastic or something, right? I'm thinking about philosophical idealism. Kant, the German philosopher, he was what was called got called a transcendental idealist. And he said that something is to be counted a viable representation, a viable thought, if it conforms. He said it's not that we should think of something as a viable representation if it conforms to the nature of the objects it represents, but rather he turned things around in what gets called the Copernican revolution. Something's to be counted an object if it conforms to the standard set by our representations. right? So that's you don't have to worry about the philosophy of that. I'm just introducing that term, a Copernican revolution, turning things around and having things hang on how we judge rather than making our judgments always countable to their objects. And so too, with respect to judgments of delusionality, right? We might say the idealist answer, what I'm calling an idealist answer, would say that judgments of madness are apt, not if they conform to some features of their objects, right, of the psychotic person, but instead if the object doesn't conforms to some feature of our judgment, right? So it doesn't conform to it. Namely, we are all in the sane gang, guys, and this other person, the form of their thought doesn't conform to the nature of our judgment. That's the thought. And R.D. Laing, in his book, The Divided Self, I'll give you a longish quote. He expresses something like this thought. I think actually he's offering it in a slightly more ironic mode, but I'll take it at face value and just offer you this as an exposition of what I'm calling the idealist take on the question of who gets to call whom mad. Laing says, when two sane persons meet, there's a mutual and reciprocal recognition of each other's identity. However, if there are discrepancies of a sufficiently radical kind remaining after attempts to align them have failed, there is no alternative but that one of us must be insane. I have no difficulty in regarding another person as psychotic if, for instance, he says he's Napoleon, whereas I say he is not. Or if he says I'm Napoleon, whereas I say I'm not. Right, it's interesting. No, it doesn't say that someone's mad if he says he's Napoleon, but he's not. It's rather, he says he's a Napoleon, whereas I say he's not. He's drawing it into this kind of debate between us, this discrepancy between us. And he says, I suggest, therefore, that sanity or psychosis is tested by the degree of conjunction or disjunction between two persons, whether one is sane by common consent. Common consent is the key phrase. They're sane by common consent, right? And if you're out with that category of the sane by common consent, then you're the psychotic person. It's the name we have for the other person in a disjunctive relationship of a particular kind. End quote from Laing. Now, okay, but we might think, hang on a minute, that sounds worryingly subjective, like idealism itself, right? Everything's just a kind of mental kind of, everything actually exists only in the mind in some sense. If I can't understand you, well, maybe that's my problem, right? Maybe we might think that, right? It can't just be that, just because, us guys don't get, I mean, here's the critique would go like this, what if you're an enlightened sage and I'm just a boring normie psychiatrist or whatever, right? Whose doors of perception haven't been opened, right? All those red-pilled philosophers and madmen, they can escape the matrix, right? But all us kind of boring blue-pilled psychiatrists and psychologists, we're just trying to keep everyone there, right? And so, how do we know that would be the kind of that would be the concern, right? Now, we might also think, though, that this kind of idealist notion is open to a certain kind of political abuse. I mean, think of in the concept of reformist delusions in the USSR. Right, some people were judged to be psychotic, to be actually delusional, because they disagreed with kind of conformist kind of opinion of state kind of sanctioned opinions about certain matters, and locked in psychiatric hospitals. As I understand it, I'm no historian of psychiatry, but I believe there was a significant abuse of psychiatric power along those lines. And if the idealist answer is right, namely you're mad just if so long as you don't kind of think as the common folk do, as the rest of us do, as the majority do, or whatever, then I think you've got to be worried about those kind of that kind of abuse that the psychiatry could fall into. And in any case, who shall be the we? What size community? Is it everybody? I mean, what if the delusional person says, well, I'm a community of one, and within my community, I'm in 100%, agreement with myself. So, butt out of my community. I'm fine, thanks. Okay. So, and just finally on this kind of what I'm calling the idealist notion, might we think instead then, and it's rather it's an empirical truth that thankfully madness isn't that common. It's not so much a conceptual truth that madness is necessarily a minority pursuit, if you like, right? It's rather just, thankfully, it's an empirical truth, a factual truth, that madness isn't that common. That's why it is the case that the person is out of sync with the majority. Okay. That's why it is that but we could imagine that the world, I don't know, broke down into terrible warfare and starvation and, dementing kind of terrors of various sorts. And maybe then we could all kind of become, I don't see that that's inconceivable myself, not just folie à deux, but folie à 7 billion. I don't see that that's going to necessarily unintelligible, right? Okay, so let's put aside idealism as a failed kind of solution to the problem of who gets to call whom mad. Might we instead say, well, no, we're going to think, let's be a bit more sensible, chaps. Can we not instead be a realist about it, right? So what does that mean? Well, maybe there's some kind of natural fact about you that makes it warranted for me to call you mad. Maybe there's some, I don't know, like neurological or cognitive mechanism, something we can all agree on as recognizing it. Doesn't involve there's no specifically kind of, as it were, psychiatric kind of judgment of delusionality that's involved in identifying the mechanism. Everyone can say, look, it's just not working. We can all see that. Now you have to agree that if you've got this cognitive mechanism gone wrong, then that's the basis for your judgment. You can justify your psychiatric judgment by appealing to something outside of it, namely the failure of this neurological or cognitive mechanism. But here's the problem. I mean, I don't know about you, but I don't really think there are any such universal mechanisms that we know of. Cognitive scientists would talk about things sometimes like, I don't know if you've read this kind of literature on delusion, but, mechanisms of belief formation. I mean, I don't know, like where they got that from. I've never seen one of these kind of, what are these mechanisms of belief formation? It's a bit like there must be one because we form beliefs, right? Well, really? I don't know. Like, I think it's just made up stuff. Anyway, and after all, we can diagnose delusion without knowing about those, right? So surely then, at best, failures in any such mechanisms will not be the criterion of, well, can't provide us with a criterion of delusion, can't provide us with something that warrants our diagnosis truly, that justifies it. All they can do is they can just describe the cause of the phenomenon, which has to be independently understood. And why can't psychiatric judgment, I mean, the judgment of insanity, right, of delusionality, just stand on its own terms? Why must its warrant be handed over to another discipline? Okay, but still, what does warrant the exclusion of the mad from the domain of reason? Here's Diana Rose writing in her work, Mad Knowledges and User-Led Research. To quote her, she says, "It is psychiatry that has constituted madness as a mental illness." I mean, maybe that's kind of roughly correct, actually. I don't know if many people talk about mental illness before doctors were kind of getting in on the act of, I'm not sure. I don't know, maybe at least they've kind of, you can imagine that psychiatrists have kind of made that more a popular kind of locution. Anyway, but, and she said its practice renders, the practice, namely of psychiatry, right, renders the mad person the antithesis of reason. And on that basis, the speech of the mad person is cut off, right? I mean, I don't think there's any reason to believe that myself, but it seems to me that madness is the antithesis of reason before it gets characterized in terms of mental illness, but okay, never mind. But we might think, though, that if someone was thinking like that, the person who is delusional could return the dubious compliment and constitute psychiatric thought as unreason. In other words, I'm proposing a kind of a relativism here. Maybe it's really the case we should think that people live in just different worlds. There's in some sense something fundamentally different about the organizing character of these different worlds, but they're all, if you like, in this relativistic picture, they're all, there's different logics, different knowledges, to use this kind of critical theory sprash, kind of, what Diana Rose kind of used it, different fundamental way of thinking, but you've got your way of thinking, I've got my way of thinking, live and let live, and that's a way to think in a way about what Lang said in that quote I said earlier. I thought there's another way of reading what he said, and I'll now read again what he said, and then I'll offer you the other way of reading what I've just read. So Lang said, the psychotic is the name we have for the other person in a disjunctive relationship of a particular kind. And read that ironically, and you might think the self-proclaimed rational psychiatrist could equally be called psychotic. It's just a matter of the disjunction, guys. That's the thought, right? To explore that thought, I'm going to introduce, well, the person in the kind of bits of the philosophical and psychiatric literature the figure who kind of espouses this relativistic thought is the one called either the psychologician or the psychological logician. I'll just give you a couple of examples today of this kind of the thought that crops up now and then. So the German logician Gottlob Frege, the famous confounder of analytical philosophy, really, he's an anti-psychologist. I don't mean he's against psychologists, right? He's against kind of psychologism in you don't need to know what this means, but I'm just telling you some stuff. He's against psychologism as a way to go with understanding logic. So he describes the psychological logician as someone who construes logical laws as descriptions of how we happen to think. So that on this picture that the psychologician offers, is if as a matter of contingent fact we had thought differently, then we would have different laws, right? And in presenting an implication of the thought of the psychologician Benno Erdmann, a kind of colleague of his, right, Frege asks, what if beings were even found whose laws of thought directly contradicted ours, so that their application often led to opposite results? The psychological logician could only accept this and say, well, for them, those laws hold, for us, these. That's why I've called it a relativism, right? You've got your world, I've got my world. Within my world, it's all tickety-boo. Within yours, you're understanding yourself, I'm understanding myself. But unfortunately, there's this kind of gulf between us that Lang talked about. Frege said, though, that he would say that here we have not a kind of case of your worlds are all, your laws are all logical laws of tickety-boo and mine are in my different way. But he'd say here we have a hitherto unknown kind of madness. That's end-to-end the Frege quote. And to give you one more example, there's a psychiatrist called Ayard von Domeres. Is this 1940s or something? I forget now. But anyway, he suggested that in a kind of fairly well-known paper that the schizophrenic subject follows alternative paralogical laws of thought. So whereas the sane logician accepts identity only upon the, he's talking about identity, one thing, something being identical, one thing being identical with another, and so on. So whereas the sane logician accepts identity only upon the basis of identical subjects, right? The schizophrenic paralogician accepts identity based upon identical predicates. I'll say what that means. That's a bit philosophical jargony. The evening star and the morning star, those are two different descriptions of an identical subject, right? So we say they're identical. Is it Venus or something? I forget now. Anyway, it's some kind of object in the night sky that people didn't realize for a while they were seeing the same thing in the morning and evening. That's my understanding of it, but that's the basic idea. It's the same, something is identical if it's the same thing, same subject in that sense, same object, if you like, same thing. Whereas what he calls the paralogician, someone suffering from schizophrenia, he thinks he's found that schizophrenic subjects he was looking at were paralogicians, and they accept identity based upon identical predicates, so that, if the same kind of quality of light was coming from two objects, then those two objects would themselves be said to be identical. Right, to give his example, a schizophrenic patient of the insane asylum of the university in Bonn identified a saint with a cigar box and with the male sex. And he did so because of what he could predicate of each one of these three different subjects. And because this predicate was the same for the three subjects, they were held to be identical, right? So saint, cigar box, male sex. If I remember rightly, the predicate was of being encircled. The cigar box has got some kind of ribbon around it. The saint's got a kind of halo. And I think in his kind of world, the male sex was just somehow encircled by the entrancing kind of encapturing, kind of emanation of the female or something like that. Anyway, yeah. Okay, I hope you get the kind of idea. And I think that, the idea, the tempting idea behind this relativistic option, the psychologician's idea, is that we can, to use the Warwick philosopher Naomi Island's rather nice phrase, now solve for understanding and utter strangeness together. You're utterly strange to me, if you're the psychotic person in this Langian disjunction, but you're not to yourself, right? And in some sense, I can kind of understand, I can understand you and think, well, in one sense, I can't understand you, but I can understand, you're still in my way of thinking. You've got your own logic. It's not that logic itself has broken down. The laws of thought have not broken down. It's just, but it's strange because they're not mine, right? And it's for sure, it's the case that the delusional or the delirious or the dreaming subject often isn't puzzled by their own peculiar thoughts. But we might ask, is it really intelligible even to them? Right? You know, they're not getting puzzled by, and if you're dreaming, pretty damn weird stuff happens when you're dreaming, right? And you don't often stop to think, oh my goodness, that's weird, right? It doesn't often happen. And people can even, I remember once had a dream in which I told a marvelous joke at the dinner table and everyone was laughing, you know, classic kind of wish fulfilling kind of like Freudian dream. And I woke up and I was really gutted to realize that not only was it not funny, it wasn't a joke, but it wasn't even a proper sentence. It was just like some garbled stream of words, right? So just because I'm not puzzled by it doesn't mean say that it's properly said to be intelligible even to me. Okay, so it's not clear that adding a to them or to us to intelligible, you know, it's intelligible to us really gets us anywhere. That'd be a worry, right? Okay, so here's my general first point. If we leave this kind of psychologician's claim in this utterly general form, if we don't look carefully into it, it might look intelligible. I mean, just to rehearse it again, you know, you've got your world with your logical laws. I've got mine. We might just both look pretty crazy to each other because we're judging each other inappropriately according to, you know, standards that are only kind of proper for our own worlds and so on. But if we look carefully at it, we actually do some philosophy rather than merely indulge this kind of metaphysical whimsy of these different kind of, you know, logical worlds or whatever. What do we actually find? I mean, take von Domerus's idea that, to quote, the logician accepts identity only upon the basis of identical subjects, whereas the schizophrenic paralogician accepts identity based upon identical predicates. Are they really working with fundamentally different understandings of identity, we might ask? Well, first of all, are they just using the word identical differently? You know, if they just mean something different by identical, two things being identical, haven't we solved rather too well for strangeness? We found that they were just talking past each other. It's like perhaps scientists who seem to be at loggerheads with each other regarding the meaning of their data, but then they realized they just used different units, or that one of them meant median by average, whilst the other one meant mean, you know, or, okay, so now we've just, in a way, collapsed the psychotic subject back into our own kind of sane logical scheme and failed to make room for the kind of strangeness aspect of their thought. And we might also ask, okay, well, if that's the case, if people are just using the word identical differently, one person means identical, he means the same thing, another person meant he's got the same kind of properties, right? Well, why is it then that, let's say, the schizophrenic paralogician just can't just bring his use into line with ours? What stops him from linguistically conforming, if that's the case? Why are we really in these two kind of separate, merely linguistic universes? Alternatively, on the other side of the kind of coin, perhaps we might say that in some sense they do mean the same by the word identical. When he says that cigar boxes, saints, and the male sex are all identical, right? He genuinely has something called a different logic of identity. They mean the same by it, i.e. identity. It's just that, I mean, I'm sorry, I just have to say, I'm spelling out a thought that does, if it doesn't make sense to you, it's because what I'm saying right now doesn't make sense, right? I mean, that's my point, okay? But I have to say it first, and then I have to say it doesn't make sense and why it doesn't make sense, okay? Right, so they mean the same by it, right? Identity. It's just that, as they'd say it, they live in different logical universes, and they somehow have different versions of what in some obscure sense is yet the same thing. I mean, perhaps it's like, I don't know, like different number systems, you know, I can't remember my GCSE maths, but if I remember, well, you know, you're different, like your base 10 that we kind of ordinarily use, but if you're a computer program or something, you maybe use base 2, you've just got ones and noughts, right? Then anyway, you might use base 12, and so you carry on counting up to, you know, 13 would be, as it were, like when we start putting the 0 on the end kind of thing to get the next anyway. But you're still using numbers in all those cases, right? But okay, but what are we really saying? How shall we tell if someone means the same by identity? We do so, it might be said, by trying to see what sense this person is making. But the radical claim on the psychologician's table is not, remember, that we're just using different words or using the same word in different ways, but that we live in different worlds with different logical laws of thought. But if we try to make sense of someone, we necessarily then bring them into our world. And so now we lose the idea of different worlds of meaning altogether. But if we keep the idea of having different logical worlds, what warrants our claim that they're speaking with their own meaning rather than simply talking nonsense as it appears to us? We can't get out of our own world on this picture after all. And within what logical scheme shall we even formulate all of these metaphysical speculations about different logical schemes? If we do it within our own one, then we can't understand what we're saying when we talk about other schemes, right? Because they just doesn't make any sense to us, these alternatives, supposed alternatives. But then shall we use another one? But then we've undone the idea of fundamentally different frameworks that constrain our thought. Okay. Fundamental notions like identity, they're constitutive of thought and hence of intelligibility in a way that, say, base 12 is not constitutive number. Hence, what Frege says, as Frege goes on to say about the psychologician, whereas other persons presume to acknowledge and to doubt a law in the same breath, effectively, it seems to me an attempt to jump out of one's own skin against which I can do no more than urgently warn them, he says. Okay, so the psychologician, to recap this relativistic option, he presented himself as humbly making room for difference. And you've got his fundamentally different, sane, on one hand, sane knowledges and rationality. On the other hand, you've got his mad knowledges, mad rationalities, as it were. And then, so we don't kind of judge as awry such thought as merely fails to conform to the model of our own. But when we think about it more carefully, when we think it through philosophically, I think we can see that it's the psychologician with his notion of alternative levels of thought who is rather hubristically and without humility offering us an only seemingly intelligible notion. So much for relativism. And I now come on to the final part of the presentation. But
I'm really sorry to interrupt you there, Richard. I've just seen we've got a time limit, Ian, for some reason. If you're happy to start maybe at so much for relativism.
Yes, sure. So much for realism, idealism, and relativism, right? That's sort of kind of got to. But what then? Well, just before moving on, let's just kind of note that something about that final psychologician's option. I think that von Domrus was noting something, right? He was confused and he tried to make metaphysically too much of it. But there is this distinctive, he was confused, but he's also characterizing, I think, noticing something important about confusion, the kind of confusion we find in, say, the dream or in the delirious subject or in formal thought disorder. Freud called it condensation, right? It's the primary process of condensation. There I am. I was just giving some. So there I am. I was sitting by the swimming pool of my childhood home, and there my brother was. But hang on, he wasn't. He was also my father, and the swimming pool was also the one near my, in my primary school, right? And this is the kind of quite common in dreams that these different things get kind of fused together, and they get fused together. That it was my father, but it's also my brother. Why is it that the dream? Well, it's often through the sharing of properties of some sort, and that was what kind of drives it. So psychologically, you can see how this kind of condensation dreams the narrative formation of a dream, or it kind of characterizes the nature of formally disordered thought quite often. Okay. But that doesn't make it into rationally cogent thought, right? It doesn't help us, but it does help to characterize it properly, but we can't make sense of it in that way. Okay. Now, I think we might also understand psychologically why someone needs to form a delusion. It's not rationally intelligible that recently divorced part-time hospital porter could think himself the King of France. As we say, you'd have to be mad to think that, right? Which doesn't mean that if you do become mad, then you can think it rationally, right? But perhaps it is psychologically intelligible. We understand his motivation to form it. Perhaps an unconscious motivation to escape from the intolerable wretchedness of his life, if not any rationality within it. Okay. Next, what I want to do, if we're not going to accept any of these kind of three answers to our question of what, we started with, what is it about believing that aliens are after you that makes you count as mad as having lost reality testing? I've suggested that there's no rule which by its very nature offers psychiatric judgment with an extra psychiatric ground. There's no kind of realism is not going to cut the mustard, for example, right? And But what I do want to do is suggest that we do recover the sui generic nature of that judgment. We don't try and cash it out in terms of something else. We try and either just spell it out psychiatrically, or this person has lost her mind, right? Or we refuse the question. So when it's what is it about believing that aliens are after you that makes you count as mad? No, you got to understand what it is to be mad is to think like this, right? It's to think like you're believing that aliens are after you, right? You get your eye in on particular cases. You learn what counts as delusional intuitively, using discernment, using kind of what we call phronesis in philosophy. Yeah. Who gets to say who is mad? Well, I also get to say, I don't know, who gets to say whether this is a pen or, this is a mug, or, this is an ellipse, or I don't know, that this is my face. I mean, no one gets to say, like this question, who gets to say, it can be very kind of gripping if you get in a certain kind of politically charged frame of mind. Who gets to say, well, no particular person gets to say, or you might say something we might say, I don't know, it's a bit funny thing to say in a way, but you might say language itself gets to say. You have to make yourself accountable to language, right? It's not we don't have to frame it in terms of this kind of a power dynamic. That might not be the right way to dissolve to tackle the question at all. Tackle the question might presuppose that there is this kind of power dynamic in play, but that might not be really the central thing to think about when it comes to the legitimacy of diagnosing insanity. The psychiatric task is to take real responsibility in judgments that are often rather fearsome in that way. Your task is sometimes to proclaim somebody insane. It can involve depriving them of their liberties. And I think it's really important that a psychiatrist doesn't hide their responsibility behind criteria or checklists, right? Realism, we might say, as I characterized it earlier, it kind of accountability shifts, if you like. I mean, a la kind of blame shifting. The psychologist or the neurologist is now the one whose categories will be taken to authoritatively disclose reality, and psychiatric judgment is supposed to piggyback on those. Well, how about not doing that? How about allowing psychiatric judgment that this poor person has lost her mind to stand on its own terms? Idealism, by contrast, is paternalistic, right? It gets to say, well, we're sane. We can self-proclaim as sane. We're in the majority. You're out with our kind of way of thinking. On that basis, I'm sorry, but you're to be judged insane in that way. That's a form of paternalism, right? And relativism, I said, it kind of offers a kind of faux humility. The kind of rational, but in a different way idea. I mean, for one thing, actually, about relativism, it kind of trashes the insanity defense. He was just differently minded. He wasn't out of his mind. Well, what are you going to say then? The insanity defense is really important, right? In law, it's not okay you might think you're being very friendly and saying, well, he's got his own way of thinking. It's just not ours. I don't think that's going to cut the mustard in the courtroom, right? You need to say that something kind of went wrong. I mean, as well as kind of losing those other exculpations we make for the insane members of our families and our work lives, it's a disaster. No, you, the psychiatrist, in your psychiatric judgment, you have to be where the buck stops. And your task, I suggest, is to step up with, this is a lovely New Testament word, this, parisia. Step up, that is, with humble boldness and the ambition of speaking truth. Become yourself a living embodiment of psychiatric wisdom. Become humbly authoritative and refine that unendingly for your whole clinical lives. Thanks.
Thank you so much, Dr. Gipps. That was really, really fascinating and a really rich topic. I realized at the beginning I forgot to promote your book. So this is Dr. Gipps' book. Would strongly recommend. I've got lots of questions, but I'm gonna open it up to everybody else initially, if anybody wants to start us off.
Yeah, sorry for the technical issues, and we've lost John Callender. I don't know if there's a way to try and bring him back in, but anyway, yeah, I mean, with psychosis, I mean, the 19th century psychiatrists called themselves alienists, this idea of a alienation of mind. But I mean, most of what we think of in relation to psychosis, insanity, there's a key feature that there seems to be a discontinuity, that the person was one way before and then something changes and they might change back again. So it's not, I mean, a lot of listening to what you were saying, Richard, I'm thinking, this isn't a static situation. Things evolve, things change. But I mean, schizophrenia par excellence is probably where altered thinking persists, whereas the psychosis of mania or psychotic depression tends to maybe recede, but there's a particular way of thinking that the psychosis is mood congruent, whereas in schizophrenia it's not. So yeah, I don't know if that helps us particularly. That we.
Let me just say,
please.
I mean, if you're worried about temporal considerations, I say, what gives somebody the right now to judge that right now I am insane? That would be the way to kind of phrase it. I wasn't trying to imply anything like that. There was what gives you the right to judge me for all time, and so on. It's just this state of mind, if you like. I mean, that could be another way to kind of keep kind of preserve the line of my thought from a worry that the real issue was, as it were, one of writing people off to core for all time and in all ways. What gives you the right now when this person is in his delusion, and after all, people can be perfectly sane in various ways whilst also being psychotic in various ways. But in respect to the delusional aspect of his thinking, what gives someone the right to say he's the mad one rather than no, the one doing the judging is the mad one? That's the kind of philosophical kind of question.
Yeah. I'm reading a book by a German psychiatrist at the moment. In fact, I'm reviewing it for the British Journal of Psychiatry, and he was in the Nazi period as a psychiatrist, but a nice psychiatrist. The book's called The Sanity Inspectors. But in that book, there's lots of old asylum psychiatry going on. And this idealistic young psychiatrist said, here's a deluded patient. She thinks that her son is being tortured in the basement. And he says to his boss, can I take this lady to the basement and show her that her son isn't being tortured, And it doesn't change. Well, okay, I can still hear him being tortured, but it's somewhere over there in the park now. It's this kind of... So it's that thing, it's not open to reason. It's not open to, once you've confirmed that it isn't, the thing shifts, sort of thing. But
sure, but as I said at the beginning, Ian, there's plenty of stubbornly recalcitrant kind of ideologues out there who we don't judge psychotic on that basis. But it certainly is important, I think, that it's important that delusion maintains at least for quite a while.
Yeah.
Right.
Yeah.
I mean, but if it was just a kind of a more fleeting thing, we'd say it was confusional or something like that, right? In a sense of just like a disorder of kind of thought. Oh, it's confused, and if you put it so that would mean that we wouldn't say it was delusional, but it's not it's a necessary but not a sufficient condition of delusion that someone's intransigent.
I might chip in here if that's all right. Hopefully this will be somewhat coherent. In asking the question, who gets to call whom mad, is there an analogy in saying who gets to say somebody else has, for example, pneumonia? And what I mean by that is, it then becomes about language, like it that's just the term we use, that's what it is, kind of thing. But there's a jump to then say this phenomena is an illness, or this phenomenon, like in asking the question that you've asked, are you trying to sort of solve the boundary problem, as it were, or is it just, are you trying to say we can object, or we can say who is mad on the grounds that that's what madness is, that's the language that we use to mean that? Is there still a gap then to say, okay, fine, we all agree that this is madness, but we might not all agree that it's illness. Or it's,
yeah.
Did that make? Hopefully, that made.
I think with I certainly understood the very last. I think yeah. Yes, I don't take myself to have made a contribution to the question of whether or not these are properly called illness. You know, the cases of cases of psychosis which are enduring are properly called illnesses or not. No, I mean I've got views on that. I could talk about it, but it's not something it's a different topic, I think. And
just following on from that, yes, you talk about the realist position, arguing that it's a failure of a particular mechanism. I mean, would you be persuaded if there were reliable biomarkers? I mean, like pneumonia, we can measure the infections and say this is an infection by such bacteria. But if we could have a good biomarker for somebody experiencing delusions or feeling depressed, would that go some way, push you towards a realist position and say that this is just well, I don't like the word madness anyway, but this form of thinking is because of a fault in that particular brain network.
Yeah, so I mean, let's imagine that were true, but it was caused by that fault in that brain mechanism. Yep, fine. But is it and we may even, because if it's a very reliable marker, you know, if it's a very good index of it, and I think often actually, you know, even kind of criteria in the ICD or whatever, DSM often are more indices than actually proper criteria. They are kind of like designed to be kind of reliable markers of something. Then yeah, bring it on, right? I mean, you know, let's use it, especially if it's easier in some way. But I don't think it tells us what it is to be deluded. It doesn't tell us. It doesn't give us an answer to our question. All that we get is that, well, you know, you've got this biomarker going on, I've got this other biomarker, you know, I don't have that biomarker going on. That would all, our language, if we were trying to reduce, as it were, our talk of psychosis to talk of biomarkers, rather than simply say it's a cause, you know, the neurological disturbance is a cause of the delusion, but if we instead it's constituted by it, I think that'd be a rather peculiar thing, rather peculiarly reductive move to make. I think we would have just kind of trashed our whole kind of concept of psychosis itself, or of delusion itself.
I mean, there is actually quite recently, a couple of weeks ago in Nature, there's a biomarker for depression, which seems to be incredibly reflecting depression in the person. It's recordings from the cingulate when they're recovering. So that, and it seems to be tightly linked to the mood of depression. It's just an association. In dreams, I think you can, by EEGs, you can tell whether this person's dreaming about people or dreaming about nature or something like that. So
but those are causal, but those are causal relations, right? I mean, you're saying that EEG, you know, that brain activity, whatever it is, because what's causing the psychiatric condition. It's not a logical claim. It's not a claim about criteria of identity. It doesn't tell us what it is to be depressed, that are certain things going on in your brain. It tells us what causes your depression. And it's fantastic if we can find it, and we can even use it as a cheat when diagnosing, right? Somebody who was psychiatric ignoramus could then come along with their little scanner or whatever the hell it is, you know, and say, well, they're the depressed ones. A bit like Searle's Chinese room. They don't have to know what they're even meaning by these words, you know, like depression, but they could know that this is a case that kind of this is a case of depression because scanner, you know, computer says yes. But I don't think it doesn't in any way kind of justify the attribution in terms of, I mean, how can I put it? If somebody was if you'd found in thousands and thousands of cases that there was this reliable correlation between biomarker and, let's say, depression, let's use the example of depression, then I can imagine if you've got another case and you say, well, is he depressed or not? If someone then found that the biomarker was present and they were trying to kind of puzzling, is this person depressed or not? I say, well, he's got the biomarker. So, you know, I think the right thing would be to say, he's got the biomarker, so probably, right? It's a bit of inductive evidence.
Well, we don't say that if somebody's got pneumonia and you look at their spit and you see the bacterium in it, you say they've got pneumonia, it's caused by that bacteria. You don't, you know, it's...
That's because in pneumonia, presumably, having those bacteria is constitutive of the condition itself. It's a criterion of it, right? It's not simply an associated cause.
Okay, so if we could get these brainwaves from people who are deluded, or at the moment it's just depression and mood, which is enough. But if we could get the similar pattern for somebody deluded, or even for delusions, then that would be quite a biomarker. I mean, that's not beyond possibility now.
No, completely. Yes, it's a good part of empirical science, right? It just happens not to provide in any sense a kind of a conceptual warrant. It provides a bit of empirical evidence. It's an empirical justification, not a conceptual justification. It doesn't provide a ground for the diagnosis. It provides a bit of evidence that the diagnosis would, in this case, be probably correct, given that it's been correct in loads of other cases. This comparison, however, there will be of course, we want to make room, unless we want to trash our concept of depression. If there are cases where people don't have the biomarker, right, but they nevertheless meeting all of the clinical features, then we could choose, I suppose, to revise our concept of depression and say, well, we choose now to not call those guys depressed; they'd be pressed or something, right? Well, but it'd be a bit random, wouldn't it? You might say there's another cause in that case of the same condition, because the condition is identified phenomenologically, not neurologically. In terms of its essence, we might identify it by a little cheat, like you just described, in a way, through something associated with the cause. But that's a separate matter. It doesn't help us with the realism that I was invoking in order to try and solve a particular philosophical conundrum. The conundrum needed dissolving rather than solving in the end. But okay. Hope that's clear.
Thanks.
There was mention in the passing about confusion. If someone went into the same mental state reliably but transiently in response to physical substances, drugs, for instance, does that have any implications? I can't really get my head around whether it does or not, but it seems at least a query, which is why I'm raising it.
Implications for what?
For the concept of madness, the centrality of delusion, if it's reliably associated with an external, or is that just a rehashing of the discussion we've just had?
So it's certainly a possibility, isn't it, that somebody can, people do flip in and out of psychosis, and so perhaps they've kept using a substance, perhaps it's something else, perhaps it's just the recurrence of a certain kind of emotional stressor, flips someone over, and then they can flip back again. There's like the dynamic system the brain goes into a different level of equilibrium as well, and then it comes back into a different stable state, and so on. People can move between these different stable states, go in and out of delirium, either drug caused or something else caused. Does that have implications, though? What was your question? Does it have implications for our concept of madness? Was that your thought?
That was what I was asking, genuinely, without a sense of whether it did or not.
I don't think it does. I think the concept of madness is applicable if it's like a very momentary thing, and then someone says, oh yeah, I was confused, or they recover themselves, just because we all have our little moments, a bit of sleep, we'd say something that's a bit nonsensical. Confusion is a phenomenon in everyday life. We think things and think, hang on, that doesn't make sense, right? If it's recoverable that quickly, then that seems okay. I think that's it's a good question. So now I've understood it. I think you can't be that quick. Otherwise, we don't properly talk about delusion. There has to be a certain temporal duration for delusion. Okay, but are you saying, so we might say that if someone flicked for like 1 second, 2 seconds each time, and then they came out with this mad stuff, right? But then they flip back, as it were, the aggregate of all of those 2 seconds is kind of be equivalent to a much longer kind of period within which we would want we'd want in order to talk about delusion in the context of a psychotic illness. I don't know. Yeah, I think we might be interested in the fact that it was always that kind of thought that he went back to when he was, and that might secure the concept of delusion rather than simply confusion for us. Yeah.
Can I ask what role does like thought disorder or not play in the argument about the other person being actually unable to understand their own thoughts, like how intelligible their version of events are, you know, when your joke was actually just a jumble of words. Is that kind of a representation of when you got a kind of thought disorder, which is quite organized? And sometimes I see people that have really done loads of research to back up their kind of delusional and much less thought disordered kind of belief system.
Are using, do you mean formal? But first of all, the kind of signal cracked up a bit then, so I'm not entirely sure I got it all. But do you mean formal thought disorder, or just thought disorder include both?
Sorry.
We've lost Ellie.
My internet's a bit on the breaking up. Sorry,
it's a bit on the blink. Yeah.
Sorry.
Can you try again with the question? We'll see if we can get it all out a bit without the
okay.
blink happening.
It was just if someone has formal thought disorder, then their thoughts might be more unintelligible to themselves.
Well, there's two things.
As opposed to someone who's got a very kind of organized delusional disorder.
Okay,
Sorry,
yeah.
Go.
Sorry, no, yeah, it's. I thought you'd finished, but you hadn't. It was just that they got stuck. So, there's someone might. I guess what I wanted to highlight was the fact that just because somebody may not be confused by themselves in any way doesn't mean that they are genuinely intelligible to oneself. I mean, just because I'm not balking at my own thoughts doesn't mean they make sense. I mean, that's the nature of kind of loss of, loss of insight and delusion. And similarly, the thought disordered person, also formerly thought disordered person, also doesn't typically balk at their thoughts. It's very interesting. I often think, I'm often just like baffled by how certain kinds of the aphasic often doesn't kind of balk at their bizarre speech production. You know, something in me just doesn't quite kind of get it. You know, like, how can you not understand that you've not said anything? You know, similarly with the thought disorder, how can you understand? Well, I mean, it's a stupid question from my part. They just don't. You know, that's the nature of the problem. Still not sure if I've grasped what your kind of query was.
But I mean, with schizophrenic thought disorder, word salad, etc. I mean, it's very distinctive, I think, compared to even aphasia. So in normal speech, there's lots of redundancy. So I'm chatting away, and you can probably guess what I'm going to say next. But when it's the formal thought disorder, it's very hard to predict what word's coming next or what words are coming next, and it's quite striking. I remember as a medical student meeting a lady from Malta who was simultaneously thought disordered in 3 or 4 languages, while smoking a cigarette through a Halloween mask and in a backward in Leverdale, and you think that it would be very hard to mimic that. I mean, the diagnosis was schizophrenia, but
yeah. I mean, I don't know what more to say about thought. I only introduced thought disorder as well as I was mainly thinking about delusion, obviously, in the piece, but I introduced it because von Domerus talked about these different logical laws, and he was trying to explicate, basically it seemed to me kind of formally thought disordered speech. Yeah, I'll leave it at that. Yeah.
Yeah, the idea of primary and secondary delusions, and that's the sort of classic literature, something like the way the person pushed the salt cellar across the table told me, I don't know, I was Bismarck or whatever the example is in the textbooks, but which like a lightning bolt or something, but it's very odd phenomenon. Yeah.
The primary delusion is an odd phenomenon. Yeah.
Richard, would you mind? Oh, sorry, go on.
Well, I'm just going to say, I mean, primary delusion is something that psychologists don't, I mean, I don't know what, you know, who knows quite what we should think about the contrast in the end between primary and secondary delusion, but it comes naturally to me at least to credit it being more, I don't know, minded like some of the phenomenological psychiatrists, but the notion of primary delusion is not one that many psychologists are naturally going to be very happy with, I suppose we could say, because they will want to kind of think that because their whole business of psychology is in thinking of a person as in the business of making sense of things, and so they will want to think of delusion as itself in the an attempt to make sense of something, whereas the whole idea of a whole delusional world of meaning kind of erupting, as it were, at once, it kind of cuts off the psychologist's endeavor, the wish to see people as always in the business of making sense of something. I mean, there are other ways in which delusion could be said to make sense of things, I think. For example, it can make something bearable and tolerable in certain ways, perhaps, even if it's a pretty dreadful delusion. It could bind inchoate anxieties, which were even more undoing for the self within its dreadful notion. And another way in which it might kind of make sense of, we could use that language of it makes sense of something, is if, well, yeah, I don't know, just it would be a kind of very reductive notion. It would be a kind of very kind of basic notion of making sense, but various kind of, I don't know, sensations and perceptions and things kind of bound up together in it in a way that was in some way a bit like kind of a bit like thinking, or a bit like kind of forming perceptual judgments. And then there's one can in a sense go on again, carry on. It gives a bit of unity to experience. Perhaps that'd be a way of putting it, a bit of unity to experience, but it's not a form of rational sense making and shouldn't be confused with it. And anyway, yeah.
With much embarrassment, the running out of time thing came up again. I thought I had unlimited time. I can only apologize. If we should.
We've got 9 minutes. We got 9 minutes. Let's see how we go.
Oh, can you? Have you got a wee clock? I don't even know.
Yeah. I'll let you know, Ian.
Chris, what were you going to? Oh, sorry, Leonie.
Oh yeah, Leonie, please go.
Well, Richard, thank you very much. It's thought-provoking, to say the least, what you've spoken to us about. And the thought that's being provoked in me is, your question about who gets to call whom mad. And I want to think, why would anybody want to do that, really? So what's the motivation behind that is what I'm thinking about. And that might open up the motivations of psychiatrists or psychologists or politicians so that's where my thoughts are going. And for psychiatrists, it could be all sorts of things, I guess. And we would want to say altruism was one, that this madness might cause this person to suffer in some way, and we'd want to stop that. And I guess we can think of scenarios of control and all of the other motivations, but that's really where I'm thinking.
There are all sorts of ways we could take that question, right? And all sorts of meanings we could give it. I gave it one very specific meaning in the context of one kind of philosophical debate, which raises certain questions about the warrant when you've got a disjunction between two people, both of whom think the other person mad, as it were. What gives I use mad glibly. I mean it in the sense of psychotic, right? So one because it's delusional. But we can also, exactly. In everyday life, people call each other mad all the time in a kind of non-clinical sense, right? That's a mad thing to think. You're a nutter. Whatever. That's just as a slur, in other words. So you can use it as a slur, or to try and project away one's own sense of, I project into you my sense of kind of confusion by saying you're the mad one. That'd be a classic one. Or like you said, kind of Foucauldian skeptical thought, it could be a bit of a power trip on the basis of certain doctors who want to be the kind of, we can imagine this sometimes happens. I don't think it's a viable historical analysis, but we can imagine occasionally someone who's a bit troubled feels a great need to call other people mad and gets off on that, and so on, right?
Well, that's another thing that's connecting up in my mind. Not that I'm an expert in any of this, but there's this this concept of epistemic injustice. So why should my view of the world be better, more true, whatever is causing the disjunct. Why is that? And it's certainly the practice of psychiatry. I think it does clinically live. that we feel we have a better version of the story.
We might want to just be kind of like careful, think, well, in some ways I do have something to say here that's rather more insightful than, because my patient unfortunately in this area is deluded, but it doesn't mean that I need to disqualify them as a knower. I mean, I think this is where some of the value of the more critical perspective is, that there are all sorts of other things that, I mustn't throw the beautiful baby of their whole mind and life out with the kind of minor bathwater of this kind of encapsulated delusion or whatever. And that seems to mean the importance of the epistemic injustice thing. I think that I'm imagining though is someone who takes that even as I would say too far, and also wants to include the delusion in it, and would as a putative kind of viable form of knowing. And that's the relativism I was kind of bulking at. But I think, I think it's really important what the epistemic injustice idea, that we don't, there's something far more important than what I'm talking about, in fact, is what you just talked about, because it has actual more practical, real ramifications and significance. Just less kind of nerdily philosophical interesting, so I didn't talk.
Chris, should we wind up before we get cut off again?
Yeah, I'm going to be really cheeky and it's a really unfair question to ask when there's only kind of a few minutes left. I wondered if you wouldn't mind just a couple of minutes. Just I really liked that idea of the apathetic versus cataphatic, if I pronounced that correctly.
Apophatic, and cataphatic.
Yeah. I just thought that was a really interesting concept, and I just wondered where. So maybe if you very quickly explain that, and just.
Oh my goodness! Okay, 4 minutes. It might be it might not work, guys. Yeah. So Chris is mentioning it's because it's kind of one of the main things I use to organize the thinking in my book, and a cataphatic approach. These are terms from theology. Cataphatic positive theology, apophatic negative theology. The cataphatic theologian tries to say positive things about God to give us a positive understanding of him, to give he is this, he's that, he's the other. The apophatic one thinks that language breaks down, and we need to kind of understand God in his kind of greatness and so on, when we understand how our ordinary ways of speaking can't possibly do justice to the object, right? And so my thought was that you can do something without wanting to in any way kind of spiritualize the psychotic subject. We can think in a similar way, can reach some understanding of what the terror of fragmentation, the breakdown of psychosis is, by understanding, not keep on trying to use ordinary psychological or ordinary rational language to try and positively characterize what's going on for them, but we can do a better justice to the breakdown by understanding why the things we might want to say can no longer be said, why the kinds of ways to try and retrieve rational meaning aren't going to be able to be used anymore. And in doing that, we can also understand why our wish to characterize the person who's suffering a mega breakdown of mind, kind of gone into a delusional reality, can understand why I wish to kind of characterize them in rather business as usual terms, employing kind of ordinary ideas of rational belief formation and so on. That in might itself be a deflection, a way of not really encountering them in the pain and dread of their condition. So that was it. Does that say something helpful, Chris?
Yeah, absolutely. Yeah, thank you. And that was very mean of me, but I just felt that the overarching theme really linked in, that the idea of what can't be said as well as what can be said.
Yes, and it's not that there's something ineffable that can't be said, right? I mean, one might, I'm not saying there is something, you just can't say it, guys. You've just got to, I don't know, intuit it or something like that, kind of reach it through some extra. I'm saying that we can be tempted to say things which shouldn't be said. In that sense, they can't be said. But what we need to do is to learn to sit amongst the ruins sometimes, and also, but not over, not to fail to notice where bits aren't ruined, as well as Leonie was urging us with the notion of epistemic injustice.
Well, thank you so much, Dr. Gipps. Really appreciate your your time. That was really, really interesting.